When kids just won't listen, parents often feel stuck between two choices: to give in or get angry. It's exhausting. We give you the top techniques directly from the experts, helping you on your path to a more peaceful, respectful, and joyful life with your kids. I really enjoyed talking and sharing stories with our guest today, Analise Lotz. She is a child life specialist in Colorado, working in the emergency department. That is hardcore. I have been a child life specialist working in an emergency department, and it's really something amazing to be incorporating play in that type of scenario. She has a degree in psychology and another degree in religious studies from the University of New Mexico, and is also a trained therapist with a master's degree in counseling and psychological services from St. Mary's University in Minnesota. Analise has been a child life specialist for 8 years. She has experience working at children's hospitals in Utah, Arizona, and Minnesota, as well as for the Make-A-Wish Foundation. Today, we discuss a lot about the role of child life in hospitals, and some of the coping strategies for kids and the rest of the family, and fun games that we've used to distract kids from discomfort during medical procedures. She says that play is about 95% of a child life specialist job. So if you want to know how to make difficult procedures of any kind, it doesn't have to be medical. If you want to know how to make them fun and easy for a child to understand, you're in good hands here with Analise. Now here's the interview. Analise Lotz, welcome to the show.
Thanks. Hi, James. Thanks for having me.
Hi, yeah, thanks for joining us. You're a child life specialist. I used to be a child life specialist, and so we should have a lot to connect on, I think, and we're going to try not to get too much into the weeds, the details about the work that we love. Try to stay out of the nitty-gritty too much. So will you tell us what it is that you love most about working with kids?
Oh my gosh, it's hard to summarize, but I love working with kids because every day is different and you never know what's going to come through those doors. I mean, I could have 5 or 6 kids coming into the hospital with, something similar, like everybody needs stitches, and everyone's going to respond differently. Everyone's had different medical experiences. Sometimes they don't even have their primary caregiver with them. So I just love kind of finding the nuances and having so much fun in my job and being able to use play as a tool to help kids cope in the hospital.
Yeah, absolutely. I know you might get this question a lot, or how much of a child life work do you think is around play?
Oh my gosh, I think it's absolutely crucial. Sometimes I struggle because people are like, oh, you just play with kids all day. But you know what? Play is actually more of the tool that I use, right? I use play and distraction and different forms of education to help facilitate coping. And so maybe that's playing with a puppet and putting Band-Aids on, or, expressing anger because a patient has been in the hospital for a long time. So we're throwing stress balls at a wall. So, I mean, I think play is probably 95% of my job.
Yeah, I have similar ideas about it, where sometimes I really want to include, we also are preparing them for procedures. We're also doing this and this. And it's yeah, but I'm generally doing that. I mean, a child life specialist is going to be doing that in a way that works for the kid. And often that's just in a playful way, right?
Yeah, especially if they're not responding in a way that you think they would to one kind of play, being able to think quickly and, divert to another type of play that they might like better. It's being flexible and having fun with it.
Is there any main thing that you would say you've learned from working with them?
Oh my gosh. I think that Oh my goodness, it's so hard. I think that it's not to like take yourself too seriously. I mean, it's really hard to walk into a room and be like, okay, I'm gonna teach this kid about having an X-ray, and instead they really want to engage with something else, So being flexible and also finding humor in a lot of things. I like a situation that I had was we were preparing a kid for a CT test, and so sometimes they have to have what's called contrast, and so it's a drink you need to have to kind of like highlight your body. And this patient was like, it's going to be delicious because it's a grown up drink and my mommy has them all the time. So still being professional in that moment and just still finding the humor and supporting that mom. But, it's so much fun to be able to laugh with those kids and still be a professional, but, help them cope through the things in the hospital.
Yeah, there's always something to find funny or humorous usually, right?
Mm-hmm. Oh my gosh, yeah.
I mean, you work in the ER, so you've seen it all, I'm sure, and even under the highest stress situations, I know that sometimes if there's a major trauma, a child life specialist is going to be, kind of booted to the back of the room if other hands need to be on the patient, but otherwise, would you say that there's kind of always a place for that?
Oh, definitely. And even in those trauma situations where sometimes, like I need to stand out and just kind of wait my turn, sometimes we're even invited in. And so then I can be at the head of the bed with the patient saying, like, this is your friend Steve, and he is your nurse, and he's giving, an IV, or Dr. So and so is checking your back to see if it's hurt. So I think that even when like the situation is really, really difficult, there's always a place for you to be that like quiet comfort voice that can help kids through anything that they're experiencing in the hospital.
Yeah, that's really interesting, and maybe that falls outside of play. You're a quiet comfort voice, introducing people. Is there a specific name for that? And what do you think? What would you say is the benefit? How does that help out?
Yeah. So when I chart, I say something like, offered verbal encouragement and comforting touch. So it's just a way to specifically say, like, I normalize the situation that, maybe you were skiing and you hit a tree. And so they're examining your body, and, this is a lot of people and a lot of equipment and a lot of noise, but that, it's a normal thing to have this happen because we're all here to help your body feel better. So just being able to be like the normalizing individual and to speak in a language that kids understand, that's what my job really is to take all the medical jargon and make it fun and creative for patients and families to really understand.
Right. And sometimes a parent can be that person if they're not also experiencing trauma, if they're not freaking out that their child's in the hospital bed, but typically they're having difficulty being calm too, wouldn't you say? And so
Definitely. Yeah. I think like a big thing with that, with what you were saying with the parents, is that, families have normal stressors, right? Like maybe somebody is missing soccer practice because they're there in the hospital, or who's going to pick up their other children, or who's going to make dinner. So just being able to kind of meet those families where they're at and acknowledge, like, I'm sure you did not want to be in the hospital at, 10 o'clock at night because somebody fell off a bunk bed. And sometimes it's even modeling for those parents, who are also like really nervous about the experience, like talking softly and talking calmly, and even telling parents kind of what their role is in the hospital and like empowering them to take care of their patients.
My father is he's a pretty cool as a cucumber kind of guy, under stress. And I remember when I was about, I don't know, 10 or 12, and I had to get a pretty minor surgery on my hand, and he was in the room, and I'd never seen him so uncomfortable. Like he almost fainted and he had to leave, and I'd never ever seen him like that. And certainly there had been other scary situations. We'd seen blood before, but there was something specific to that environment that, he could have used some support, and I was handling it fine, but I guess I'm just highlighting that you kind of never know. People go into a situation, in a hospital especially, and our usual routines and patterns are just kind of thrown in the air for a lot of people. And so maybe you can talk a little bit about how child life works for the parents. I mean, how often do you find yourself serving them, and what does that look like?
Oh my gosh, I think it happens all the time. Often, so say I'm going to go talk to a kid about having stitches, right? And we talk about how, it's like a string Band-Aid, and that's what's kind of bringing it all together. And it's actually the parents that are so excited to like touch the string and see the different tools, because, they know that it's, a string kind of sewing the skin back up, but they don't know that it's actually like a curved needle. And, it's a learning opportunity for the parents as well as the patient. I think several times in my career, I've had times where the parents have been prepped and they're prepared and they, consent and they know what's going on. And then I go to prepare their patient and the parents are like, oh my gosh, that's what you're doing? Like, now I really understand it, because it's put in a way that they can digest as well. As well as there's so many times that I just empower those patients' parents, and I say things like, would you like to sit on the bed and have, your daughter sit on your lap? And so it's getting like a big comforting hug from you instead of laying down. Or, maybe their patients are really young, and I say, I just want you to keep talking to them so they can hear your voice and
Absolutely.
be soothed, and that can be something silly like, tell them what you're going to make for dinner. Like, whatever you tell them, they're going to listen to, because it's your voice and you have that power as a parent. So, yeah, it's not like Grey's Anatomy. Like, there's a lot more human things on board, and being able to empower those parents is a big part of child life.
Right. You definitely have to have some storytelling skills if you're going to make it in that business, huh?
Oh yeah, definitely.
All right, so let's talk about something that everybody who's got kids is going to deal with sometime, which is, going in for something routine, like a shot, for example. Some kids just handle it like it's nothing, and other kids, it seems like, how could we ever do this? So So, yeah, I guess where do you start when you first meet a family, a child, and you're trying to figure out how the shot's going to go down?
Yeah. So I think my number one thing is to always introduce myself and kind of what my role is in the hospital. And then I like to ask the patient, why are you here today? Just to kind of gauge, like, what have they heard? What do they know? What are they suspecting? And then I introduce, maybe, for example, maybe Jimmy stepped on like a nail, and so he needs a tetanus shot. So kind of bridging like the injury into the the result, which is the shot itself. I also like to always gauge with the parents, like, how do they do with these at their normal physician's office, kind of, so I have some kind of baseline.
Right.
And then my biggest thing is I always tell kids step by step what's going to happen. So that's, I use all the senses, like, you're going to see this, you're going to hear this, you might taste this. And so with an injection, it's like, we're going to look at your muscle, like in your arm, where we're going to put it. We're going to clean your skin. You're going to feel the injection, and then we're going to put a Band-Aid on. So they know specifically everything that's going to happen. And from that, I develop a coping plan, So this might sound kind of hard for you because you don't like shots. What if we sit on mom's lap? And what if I cover it up with a towel so you don't even have to see? And then the fun part for me is, how are we going to engage you visually so you don't even have to see what's coming? Are you going to look at my iPad? Do you want to play with a kaleidoscope? Like, what can we do that's going to distract you? As well as I like to offer some other kind of coping, like, do you want to squeeze a stress ball? Do you want to take a deep breath? What is going to be most beneficial for you? And so after the kid has all that information, I ask them, like, what do you think your biggest job is here? And if kids kind of shrug their shoulders and they don't know, I say something goofy like, is this the best time to have a dance party? Or do you think you should hold really, really still? And so kind of still tie in that play section, but still empowering that patient to be like, okay, my job is to hold still and take deep breaths and it'll be done quickly. So that's kind of what that role looks like for something simple.
So you're introducing yourself and you're saying to the kid, why are you here today? And I just want to remind listeners, I want to go through this because a parent can do all of these things. A child life specialist is not required, to have this conversation. Is that right?
Mm-hmm. Yep, exactly.
So a parent might ask, why is the kid here today? And then going through that kind of step by step, this is what you're going to hear. This is what you're going to taste. Sometimes they do have to drink that juice or whatever, medicine. So before I go on with the other steps, when a child is let's say a little extra challenging to work with and is not interested in going there with you or having that rapport, or maybe you're having an off day and you're having trouble connecting, which I think happens to all of us. Do you have any other kind of tools or plan for when the conversation isn't so textbook?
Yeah. I think, so let's continue with our example with like the shot, right?
Uh-huh.
Nobody likes those. And so, if like my patient is still really, really scared and they're really, nervous and there's a lot of crying and don't want this to happen, it's my job to kind of help set those boundaries sometimes and say, I know that you don't want this, but I'm going to count to 10 and let's get it done because I don't want your body to be scared. So, saying like, I know this is difficult, but we got to get it done, as well as offering like another choice. Like, can I shield this from view with a towel so you don't have to wash this? Or maybe I'm going to utilize like something that like vibrates on your skin to kind of help block that receptor. So kind of trying to engage like one more time with like choices. And if I need to, using another form of visual distraction. So it's tricky sometimes though, so like kids have had hard times experiencing this and they don't want it to happen. And so just trying to find the best solution to help them get through it.
Do you ever find that you get pushback from the family? And again, I'm trying to put myself in the parent's shoes that might be thinking, this is too much. We wanted to get in and get out, and
yeah,
he doesn't need all this stuff. Let's get it over with. What do you think that's about, and how do you address that?
I do have that sometimes, and I think it's coming from a place of kind of not knowing and also experience, because I think that's kind of like the old school way, right? It's just getting things in and out and on your way.
Mm-hmm.
And so I always respect the family's decision with that. But, then I like to shift my focus and act more of like a coach during the procedure instead of like preparing before it. So, say it's that injection and we're going in, then I just say, okay, we're going to clean your arm. Nurse cleans your arm. Here comes this poke. Take a big breath in, do it. And then that way it can be done quicker. But I'm still trying to empower that patient as much as I can while still respecting the family's wishes.
If you were to advocate for the need for a child life specialist, if you're talking to someone, again, maybe not in that necessary situation where I'm not talking about, criticizing the family or whatever. What is the argument? What is the main goal here?
Yeah.
I mean, yes, maybe the kid feels a little better, but we're taking more time. And I know that sometimes there's other professionals in the room and they all have their protocols, and there can be some stepping on each other's toes occasionally. So what would you say is kind of the overall mission or goal of being there?
Oh my gosh, that's a really good question. I think the role of child life in this is twofold. We want the child to have as good of an experience as possible with the healthcare. because we want them to grow up to be like happy, healthy adults that, have had good healthcare experiences and aren't fearful of coming back as adults, as well as in my role as a child life specialist, I can concentrate on, the needs of this patient and the family. And that allows my team, the doctors, the nurses, the techs, whoever else is in the room, to focus on like helping, the physical body, right? So I'm taking care of like their mental needs and they're focusing on the physical needs. And so that's what puts us like beautifully together. And that way, like I can take a load off of them and also helping this family to have the best experience they can. So that's, I think, the biggest role for child life.
Yeah. So I'm going to go back to trying to kind of summarize a little bit of the approach that I heard. And I know you said it once, and so feel free to stop me and add or subtract. But again, if I'm trying to learn this as someone who's not trained in this, I'm listening to the steps. I hear you're starting with kind of why are you here today? You're assessing where the child is mentally and emotionally about the situation. And I'm guessing that even if someone's told them 5 times, that might not mean that they are all there or understand that at the moment.
Mm-hmm.
So I'm wondering if that's part of a conversation that a parent would have, and would they do that? Like, do you do that the same day? How do you do that 5 minutes before a procedure, or when is it important to have that conversation with the kid?
Ooh, that's tricky.
Yeah.
Because, based on like how old your kid is, sometimes they can handle knowing information further out versus, if they're younger, they do better right before. So I think it's kind of like getting to know your kid a little bit more and kind of seeing how they do with information like that. You can even talk about silly things like, tomorrow we're going to have spaghetti for dinner, and see if your child kind of knows that. And so being able to like recall that information, that kind of gauges you like, okay, maybe we should talk about going to the doctor next week, kind of seeing what their timeline looks like. I think that's like the best way of kind of starting to like learn that with your patient. But I think it's always approached in like an honest way. We're going to go to the doctor. Maybe they don't know what they're going to do with the doctor, but at first we're going to go to the doctor. And then maybe when it's getting closer, they're going to check your body out. And then maybe if they're younger, you might need to get a shot today. And the reason for that is because we want to keep your body nice and healthy. So just approaching it in like a safe and honest way and not surprising kids with things that might be really difficult when you can.
Yeah, that's another one of those that's, a compact piece of advice. But I think if we look at all the stories we tell ourselves and our children, with all the best intentions, that, oh, no, it's not going to hurt. Like there's so many things that just come out of our mouths sometimes that aren't really the whole truth there.
Yep.
And how crucial it is in the relationship with the child, in the child's future, relationship with healthcare, that they're getting the whole story. Is there an age when that should start? Is there, oh, he's just 2, we can tell him whatever?
I think that's my biggest thing when I meet patients is I always tell them like, it's not my job to lie to you. I think there's always a way to tell kids the truth, even if like that's, I don't really know how that's going to taste. Why don't you try it and tell me,
Yeah.
And that's open and honest. You're not saying, oh, that's going to taste really, really gross, because if you tell your child that, they're not going to want to try it. Right.
Right.
So approaching things with like a questioning manner and helping create that sense of wonder for your child instead of giving them something that they are already going to be like not thrilled to do.
Okay. Yeah. So using a question is a way of kind of putting it back to them and letting them know that even if you did have a terrible experience when you were a child, that doesn't mean that your own child will. And you could, by putting in a question saying, I don't know necessarily how you're going to experience this. Maybe here's what I do know. Here's a lot of ways to talk about it without lying, and but also without coloring how their experience is going to be in a way that keeps them from being able to engage in it their way and cope with it their way.
Exactly. Yep. That's a great.
That's a big conversation. I'm sure it's something that may take a lifetime, I think, to really get all the nuances there, but it's worth it. Okay, so then you're kind of moving on with the walking them through it, what the procedure is going to look like. Here's what we're going to be doing. Here's what you're going to be hearing. And then I heard you say something like, so this might sound hard for you.
I kind of do it based on their facial expressions. If a kid starts getting teary or their eyebrow gets really furrowed, that then, it gives me a sense of saying oh my gosh, what did I say that sounds hard for you? Or, you seem kind of scared right now. Can you tell me what's making you scared? So kind of feeling off their expressions and kind of gauging the next steps from there.
Yeah. And so I guess in a way you're kind of opening the door for them to talk about, if it is hard for them, you want to be there for them to talk about it.
Yeah.
Again, without your own, let me tell you why this is going to be really hard for you, right?
Right. Because I don't want to put any preconceived notion from my experiences, in the hospital on them. So I want them to have their own experience.
And then some more language that I loved was kind of how are we going to make this more beneficial, more easy? How, you're kind of brainstorming with the child. What do you think is going to work for you to help you get through this? And of course, you have a whole bag of tricks of things that work sometimes for some kids, but it sounds like it's important to include the kid in the conversation from the get-go.
Yeah. I mean, it's their body, right? It's their story. This is something that they're going to experience. I'm like a teammate, right? So I can come alongside them and offer suggestions and help them through this experience. But ultimately, it's their story to tell. I'm just a small part of it.
And yeah, in that regard, you're also offering choices.
Yep.
What do you think it is about offering choices that helps make the situation easier? I think the concern is that if you offer choices, then you're just giving a kid or anybody, ways to kind of get off the hook. They're going to come up with things that spoil the important medical plan at hand. Yeah, just tell us more about the offering choices and how that works and why that works.
So my job is to get them through whatever experience they're having, right? So I'm going to make the choices that I offer appropriate and something that they can do, right? Would you, say we're going to do, I'm trying to think of a good example. So say we're going to do a finger poke, for maybe a diabetes test. Which finger would you like? Left hand or right hand? That's something a patient can choose, right? Would you like a pink Band-Aid or a yellow Band-Aid? That's something they can choose. There's so many things that they don't get to choose and that, things that have to happen. So empowering them in a way to choose something that they can allows them to play a part in the experience that otherwise would just be decided for them.
I also heard you mention basically distraction techniques. And I have found that distraction techniques work in a lot of scenarios. You don't have to be in a hospital to take advantage of how powerful it is. Where we put our attention and our minds is, that's what we're focused on. And sometimes in a conversation and an argument and so many things, whether that's with a child or with anybody, changing the subject of focus is very powerful. So tell us about some of the distraction techniques. What specifically, again, if I'm just a parent looking for what I can do next time I go into the hospital with a child, what are some of your favorites? And maybe,
Oh my gosh.
Are they dependent on age or, have at it.
Yeah. Okay. So I mean, I've gotten calls before that like I have no toys on my body, right? And they need this to happen like right now. So I have to be my own best tool. And so things that I find easy are counting, because if you tell a patient like, okay, we're going to count to 10 and then this picture is going to be done, like that is distracting enough, and they know what's coming next and they know when it's going to be complete. So that's a good distraction. If you ever need a patient to look at you, I always say like, hey, what color are my eyes? Or do I have any freckles on my face? And that's something that is very distracting because that's my face, right? I sing a whole lot of songs, like the Wheels on the Bus. You can do so many things with that song. So that's always a great distraction. As well as sometimes even like lowering the volume of your voice. Like if you're talking at like a normal level and you start whispering, that kind of like makes the child more heightened and has to listen to you better. So those are kind of like quick examples that I like to use. Or even like I spy in a room. You know, you can always do something with colors or shapes, or anything can be a distraction if you look at it that way.
I spy in a room is what does that look
gosh.
like? Mm-hmm.
Yeah. So let's say I'm in Costco with my kid and I can say something like, I spy something red, you know, or I spy something square, or, you know, something like that. And you can even do something goofy like, I see somebody who looks really kind, you know, and kind of cluing into those feelings and emotions.
No, not that person. The other one over there.
Right. Like, no. That guy's totally mean.
Yeah.
But kind of seeing like what your kid is saying, you know, maybe they are cueing into other people's conversations, or, I mean, it just can be a really great learning experience when you would play a game like that.
Absolutely. Yeah. And I've got to add my favorite, which is bubbles.
Oh my gosh, bubbles. They're so great.
They work on so many levels for so many ages.
Mm-hmm.
And yeah, I keep them on hand all the time because you never know. And it's just
you never know.
It doesn't have to be a situation where a kid's crying and screaming and someone's upset. You know, something like bubbles, and I'm sure plenty of other distractions. Well, sometimes that's a great way to get the kid to stay at the table at the restaurant instead of running down the aisles or wherever they're going.
Exactly. Yep.
And
or like it's even therapeutic. Like you have to take a big breath in to blow out those bubbles, so they can have way more than one focus. It's awesome.
Yeah. I'll put the link to my favorite bubbles. I'm sure you have your own favorite bubbles. Maybe we can compare there. But,
there you go.
Buy them in the 50 pack and get the ones that won't spill out in your purse or pocket. Those are really great to have. Tell us about some of your favorite resources that you would recommend to people.
You know, I think my biggest thing is to even look on like the Association of Child Life Professionals webpage. I think there's so many great articles on there, and there's so many great examples of awesome things that Child Life has done. So kind of learning from that. I also like to look at things on YouTube, like videos on like active listening and motivational interviewing, because that's a big part of my job, and that's something that like anybody can put into practice with their own children. So I think those are kind of like, you know, the bread and butter of my child life practice.
Yeah. And I know you're not probably going to be inviting people to come see you in the emergency room, but is there somewhere we can learn more about you, or just, I'm wondering, where would somebody go if they wanted to maybe even contribute to what it is you're doing, or child life.
Yeah, I think the best thing, if people have questions or want to reach out to me, LinkedIn is the best solution. I just Analise Lotz on LinkedIn. Otherwise, I really don't encourage people to come visit me in the ED. I want you guys to be healthy and happy. But I think that if, your child is at a hospital and you're kind of questioning what to do, I think you can always ask if they have a child life specialist on staff and they can kind of help with that. But, yeah, that's probably the best thing to contact me with.
Great. And I know I could talk to you forever, but in the interest of time, do you have any parting thoughts? I know we probably jumped around a lot and maybe skipped over some things. Is there anything that you wanted to say before we say goodbye?
Oh my gosh, I think one more thing that I just kind of want to provide some advice with when talking to your child is try really hard not to say the phrase, "you're okay." I think that we say it all the time in society. And I mean, I tell my dog she's okay all the time, but trying to find other ways to validate your child, say like, "Oh my gosh, like I know you just crashed on your bike and I'm sure that was really, really scary. Should we put a Band-Aid on your leg?" Or something like that to really acknowledge their experience, but not minimize it in just the phrase, "you're okay."
Yeah, another big one. You're fine.
Yeah.
Even again, said with the absolute nicest intentions, you're
Mm-hmm.
not, you don't
Right.
have to be yelling, "Oh, get up, you're fine." People will do that in a way that they want you to be fine, and they might think that you're fine, and so they're letting you know that you're fine. But I think one of the most important things I learned from child life is how different kids are from each other, and just and how with anyone really, some events that look small from the outside can be really big and powerful to someone else. And it's always better to start with the question and try to assess, how somebody's doing with something.
Yeah.
Sometimes just taking off a Band-Aid can ruin somebody's day. And, if you approach it with I don't know, without that curiosity or empathy, what seems minor can end up becoming, traumatic or really upsetting. So,
yeah, exactly.
Great advice. Okay, well, unless you have anything else, I know you've stayed up. You work the late night shift, and it's past your bedtime. So,
yep, nap time
Annalise,
for me.
I really enjoyed talking with you. You're welcome back anytime, and I just really support child life. I think everyone should go figure out what child life is, because it's a crime how few people understand or know of what it is we do, and how powerful it is, and how we can use it in our homes and our everyday lives to cope with all kinds of stress. So
I agree.
Thanks for your time. Thanks
Yeah.
for being on the show.
Thanks so much, James. I really appreciate it.
All right. Bye.
Bye.